See. Good afternoon, Rotarians and guests. Welcome to the Rotary Club of Toledo. Thanks for joining us this afternoon. I'd like to first acknowledge Walt Churchill's Market as this month's meeting sponsor and thank Rotarian Kunal Dawar for his support. Kunal, I don't think he's in the room. Thank you, Kunal. Before we get started today, please feel free to take a quick moment to check in for membership. Still being active, we had last week, what do you have, the holiday party. We have all kinds of things that are happening this month, so people have been posting like crazy. I'm sure all those scores are going up. We'll do an engagement, a membership engagement score check maybe next month. At this time, I'd like to ask Carol Subcheck to please come to the podium and deliver a reflection, as well as lead us in the Pledge of Allegiance. Please stand.
Good afternoon, President Scott, fellow Rotarians. I was all ready today for a very joyful Christmas message of hope and rejoicing, but I woke up and heard the news today. And I heard a lot of murder and hatred and shootings and killings. And not to be a downer, but one line of one prayer just stuck in my head, and I think it's really appropriate for us to think about this today. And it's, Lord, make me an instrument of thy peace. So please let us all as Rotarians think today about at least one or maybe even 100 things we can do to foster peace in this world today. Amen. Please join me in our Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Carol. Appreciate that. Does anyone have any guests today that they would like to introduce? Zach is in the center of the room with the floor mic. If you'd like to introduce any guests that you've brought along with you today. I see there's a couple. Fred's got one.
I have Yasser Alawani, who is the Dean of Lord's College of Business and Leadership with me today.
Excellent. Welcome.
I have Gyron Horton from Horton Financial.
Great. Thanks for joining us. Appreciate it. Thanks, Tim.
Hi, I've got Melissa Steingraber here, and she is our Director of Operations for Talbot Health Services.
Excellent. Thanks for joining us. Appreciate it. And then, MAHJIDA, if you want to introduce your guests later, you can introduce your guests from the podium, because I know you've got several, too. Thank you all for coming today. We really appreciate it. I did want to make a note, too, about last week's program. If you didn't have a chance, Tom Seaman was here for last week's program. It was a really great facilitated discussion, and it was about Tom's book. And I've had a couple Rotarians come up to me, including John Federici, approached me today about the book. He's just now going through it, but the book's really great. It's something excellent to read. It's got a great message to it. Obviously, it's also focuses on Toledo. So if you haven't read it, you might want to take an opportunity to. And I think that was if you haven't seen the presentation with Tom, you can also see it on YouTube. So we do have all our Monday meetings recorded on YouTube if you want to go back and look. All right, great. Let's get to today's program. We are honored to be joined today by MAHJIDA BERRYMAN. She is the supervisor of injury prevention at the Toledo Lucas County Health Department. As the organizer of the annual Chalk Walk for Overdose Awareness Day, MAHJIDA brings hundreds of community members together to remember lost loved ones, raise awareness, and spark action in the fight against addiction. The event that has become one of the region's most impactful gatherings for healing and advocacy. BERRYMAN also has spearheaded the launch of the naloxone vending machines at the Lucas County Correctional Center, making Lucas County one of the first in Ohio to offer this life-saving initiative inside a jail. MAHJIDA has also emerged as a leading voice in harm reduction and public health innovation. She was honored with the Syringe Services Program of the Year Award, recognizing her leadership in protecting community health and expanding awareness of life-saving services. Please assist me in welcoming MAHJIDA to the stage. Thank you, MAHJIDA.
I'm a little bit shorter than you. All right, which way does this go? Turn on. Cool. Hi, everyone. Like Scott said, my name is BERRYMAN, and I'm the supervisor of injury prevention at the Toledo Lucas County Health Department. I'm just so excited to be here today. This is definitely a topic that is near and dear to my heart, and one that I know is near and dear to many people probably in this room. And it's just definitely one that I like to educate our community on as well. So today we're going to be talking about the opioid epidemic. We're going to talk about the impact that it's had here locally in Lucas County. And we're also going to talk a little bit about how, as a public health agency, we have been able to implement some different things, strategies, and different ways to work on kind of mitigating the burden that it's taking on our community. So I am excited to talk to you about that today, but I also do want to leave you with some practical strategies that you also might be able to implement into your daily lives that would also help us work towards a solution as well. So a little bit about me. I have worked at the health department for 11 years now. I have worked in substance use prevention since around 2017, and then on opioids specifically since around 2019. So right before the pandemic began, I switched over to overdose prevention work. And unfortunately, like many others, maybe some people in this room, I'm someone who's loved someone with substance use disorder and lost someone to drug overdose. When I was 16, my sister's mom passed away from a drug overdose. And that's definitely something that stuck with us growing up and was something that impacts our lives still today. I do want to right up front say, and I actually really appreciate the words that Carol just shared, because this is not a cheerful topic. There's a lot of somber notes. We have to get through some hard stuff before we get to those ideas of hope and solution. And I do just want to say this is a topic that definitely has some big feelings around it. So whether you're someone who's lost someone to substance use disorder, or it's impacted your life in some way, or whether like you've had very limited access or experience with substance use disorder, there are still some really big feelings around it. So just acknowledging that up front, and then also taking the time to say that, as we dive in, a lot of statistics will be shared. All of these statistics, whether it's about someone who is lost or someone who's still living, those are all human stories. So I just want to acknowledge that as well. They're literal human lives that we're going to be talking about, and these are people who have always deserved respect, deserve dignity, and deserve to be treated as a whole person that they are. So with that all in mind, I am going to dive right in. So every time I talk about the opioid epidemic, I really like to start with kind of the background of how we even got here today. So going back a little bit in history. But I just want to acknowledge also that the opioid epidemic didn't start in a vacuum. It followed earlier substance use crises and policy eras that shaped today's landscape. But the late 90s brought a distinct rise in prescription overdoses, and this did change the scale of the problem and then the way that we address it as well. So a lot of professionals in our field like to refer to the opioid epidemic in waves, so in 3 waves specifically. And that first wave begins around the 90s when there's a significant increase in overdose deaths, and this was due primarily to prescription medication. So this is a time when Big Pharma was really predatory, especially to people who were dealing with chronic pain, and especially in places where there were more industrial-based communities. And so this was a time when drugs like OxyContin was hitting the market. These were being marketed as non-addictive, non-opioids. Education was being provided to prescribers that this was going to change the lives of their chronic pain patients. And this is also something that they were very confident, you know, if your chronic pain patient's still experiencing pain, just give them more. It's non-addictive, it's not an opioid. And the reality is that addiction often begins with prescription medications that people were legally prescribed by someone that they trusted. And once their body became dependent to these prescriptions, and these prescriptions were not able to be accessed by them anymore, they turned to whatever they could access. And this is evident in the second wave of the opioid epidemic, where there's a clear rise in overdose deaths that were linked to heroin. Has anyone here ever watched the docudrama Dope Sick on Hulu? That's a really fantastic, it's a really fantastic show, first of all, with great acting, but it also really goes through the opioid epidemic and the history of the prescription from many viewpoints, from a doctor's viewpoint, from folks that were dealing with substance use disorder, and then also from the pharmacy side too, what these pharmacy reps were educating doctors on, and inventing the fifth vital sign as pain, inventing terms like breakthrough pain, you know, someone experiencing pain after they've already been given the medication that should address that. So it's definitely a really good show to watch to kind of get an idea of how we got here today. But anyway, back to the rise in heroin. So when prescriptions became harder, this might have been due to, you know, tighter prescribing rules or monitoring systems. Heroin was significantly cheaper and easier to buy than prescription pills on the street, so it was much easier for folks to find. Drug trafficking networks were also able to expand the supply of heroin and were able to intentionally move into new markets where people were becoming cut off from prescription opioids. So still a pretty predatory time. Now we're in the third wave. This pretty much still reflects where we are today. This is a rise in synthetic opioids like fentanyl, something we're all probably familiar with by now. Fentanyl is 30 to 50 times stronger than heroin. Only tiny amounts are needed to create a dose. So this means it's much cheaper to produce, it's much cheaper to sell compared to heroin. Synthetic fentanyl is made in a lab, so we're not talking about the same fentanyl that is very safe to use while under, you know, a doctor's orders, when you're getting surgery or in the hospital or whatever it may be. But this is a synthetic man-made fentanyl in a lab using inexpensive chemicals, unlike heroin, which depends on farming. It increases potency of heroin, and then by the time people who were using heroin realized that they were using fentanyl, it was already widespread. So fentanyl can now be found in counterfeit pills, cocaine, methamphetamines, and other pressed tablets that are sold and marketed in various other drugs. But the reality is that people use substances to cope with pain, and whether that's physical, emotional, or both, whether they're trying to feel normal, or coping with trauma or stress or chronic pain, like I talked about, or mental health challenges, substance use fills a gap in their life that wasn't being met anywhere else. And in fact, trauma is one of the strongest predictors of drug use. Most people who struggle with substance use have lived through things that most of us can't imagine. Other factors do include genetics, so a history with criminal legal system involvement, early use in adolescence, so the earlier that you begin to use substances, the more likely you are to develop substance use disorder, or other social or environmental factors like not having stable housing, or financial stress, or unemployment, or limited access to supportive services. I also want to take a more granular look on Lucas County specifically, and because we have really great partners like the Lucas County Coroner's Office, we have access to a lot of data that can help us influence the work that we do and our response efforts. So part of my job is to review every overdose death that occurs in Lucas County, to learn about these folks, to learn about different touch points that they might have had in the system so that we can work together strategically to make changes to that system. Starting in 2014, this is where this chart specifically starts. This was when the health department began to implement its first overdose prevention strategies. Overdoses were just rising year after year. Ultimately, they peaked in 2020, which is when Lucas County experienced a loss of 296 individuals due to opioid overdose-related deaths. We knew that there were going to be risks associated with the threats of the pandemic. This was also when I entered this job, so it was really a lot of pressure there. But there was, going to be themes of isolation, mental health issues being exacerbated. But the community just had a really strong urge to come together and prioritize collaboration, and that's what we did. I feel like for the first couple of months, we were on the phone like once a week, maybe more. The health department, Toledo Fire Department, Lucas County Sheriff's Drug Abuse Response Team, the DART team, our coalition partners, our treatment providers, and we just continue to have these conversations where we realized that there was absolutely no gatekeeping. There couldn't be. We had to share our resources. We had to share everything that we knew to help people get connected and stay connected, because connection's the opposite of addiction, right? And so we just tried to flood the community with our resources. We were doing pop-up naloxone distribution events. We were doing drive-through events where information could be shared. And all of our hard work paid off, because we were one of the only counties in Ohio from 2020 to 2021 that experienced a decrease in overdoses. Almost every county in Ohio experienced an increase. And thankfully, as a community, we've been able to continue that momentum in many aspects and continue to see a downward trend. However, this is something that we have to continue to prioritize, and it's work that we have to continue to support and do. So last year, from 2023 to 2024, Lucas County saw a 27.83% decrease in opioid overdose deaths, but we ultimately want that number to be 0. So like I said, as a health department, we have a lot of access to data, which can help us be really strategic about the work we do. We're not just throwing spaghetti at a wall and seeing what sticks. But I have a team of 6, including myself, working on overdose prevention efforts. And then to be as strategic as possible, we're just always looking at what that data tells us to do. So here's an example of that, some geographical and demographic data points that can help us just really hone in on those strategies. So over time, we can see how the landscape of overdoses changes in specific zip codes. We can cross-reference that with the impact of what we're doing in those zip codes where we're distributing resources, and then zip codes data reflecting, where those individuals that are accessing our resources live, and then we can see how that might make an impact later down the road. So an example of seeing some significant decreases of overdose death, and I don't want to bore you with a ton of data, but I think this is really important when we're thinking about our own backyard, because some of this information can be really surprising to folks. But some examples of seeing significant decreases over the last year, which I would categorize as like a greater percentage than what we're seeing for the county as a whole, so over 27%. We've seen a 29% decrease in fatalities in 43604, but all the way to seeing a 80% decrease in fatalities over the last year in 43611, Sun Point Place. So that's a pretty significant decrease. Other zip codes that we have seen significant decrease in fatalities in include 43613, 1520 and 23. That doesn't mean the problem's over. It just means that we're doing a pretty good job of getting some work done in those areas. But then we also, on the flip side, also see zip codes with significant increases as well. And that would include places like Holland, where we saw a 100% increase in overdose deaths over the last year, or Maumee, where we've seen a 300% increase in overdose deaths in the last year. Other zip codes that we're seeing significant increases, 43607, 09, and 16. And this just gives us a map of where we need to go as a community, where we need to make better partnerships, where we need to make resources and access to treatment and care and compassionate places like that available, and talk about that more, right? Build more connection. Data also shows us that there are just times when people are at higher risk of overdose. And so that would be things like including a period of abstinence. So maybe someone was in jail for a period of time. Maybe they were in a treatment and recovery center for a period of time. And they're going to have a lower tolerance when they leave. So they're at a higher risk of overdose if they return to use. Also, following an overdose event is a higher time when someone might be at risk of overdose. And then, of course, when there's a change in the drug supply or source. So whenever you see an article like State Highway Patrol, huge drug seizure, that's going to be a time when folks are actually at risk of a higher risk of overdose because they're going to turn to substances that they aren't used to purchasing, new dealers, things like that. So it's really important that those are times when we are strategic as possible about our messaging as well and make sure that our resources are accessible. I have some fun things on this slide. Anyway, before we dive into our strategies, if you're not familiar, I want to introduce you to the concept of harm reduction. So in my world, harm reduction is a practical and compassionate approach to reduce the harms of drug use. But it's also a social justice movement that's based on the fact that people deserve to live even when systems say that they don't. Harm reduction demands respect and dignity for people who use drugs. It removes barriers to care, prioritizing quality health care access for all, regardless of if someone is using drugs or not, with the goal of just staying alive and connected to care. But harm reduction is also a concept that gets boiled down to a very simple public health framework. Just intentional practices and policies that are designed to lessen negative consequences associated to various human behaviors. So in his stand-up, the comedian Jerry Seinfeld once said, there are many things that I think you can point to as proof that the human being is not smart. But my personal favorite would have to be the fact that we had to invent the helmet. Apparently, we were participating in many activities that were cracking our heads. So we looked at the situation and we chose not to avoid those activities, but instead to come up with some sort of a device to help us continue our head cracking lifestyles. So the helmet, so harm reduction, right? And though our team takes on many strategies through various grants provided by state and federal partners, that's how the majority of our funding comes, I'm just gonna focus on two main branches of our efforts. So the first area of focus is going to be our community outreach and naloxone distribution. So for anyone who's not familiar, naloxone is an overdose reversal medication. And if there's anything that I want you to take away from this presentation today, it's that naloxone is simple, safe, and legal. Naloxone is so simple that training someone to administer it takes less than 5 minutes. It's so safe that its only job is to knock opioids off the receptors on the brain and restore breathing. So if you give naloxone to someone who's not experiencing an overdose, nothing's going to happen. And it's so legal and effective that all 50 states have put in laws that bypass the FDA, making it accessible to people without a prescription. Any person or government entity is allowed to distribute it to others, and oftentimes you can find it for free. Nearly all 50 states, including Ohio, also have Good Samaritan laws, making sure that anyone responding to saving a life in good faith are free from liabilities. And in some states, again, including Ohio, this also includes sections for individuals who may be free from prosecution for holding small amounts of drugs or paraphernalia in the event of responding to an overdose. So this is prioritizing saving someone's life rather than throwing someone in jail for doing something wrong. Last year, our team distributed nearly 19,000 naloxone kits into the community through a variety of strategies, which I will be telling you a little bit about. But we also distribute other items like testing strips, drug disposal bags. But one statistic that I want to point out here is that through data that's collected during naloxone distribution, we were able to document 1,936 successful overdose reversals using naloxone in Lucas County. So that's quite literally nearly 2,000 lives that were saved. And that's only the ones that we know about too. We know that this is a statistic that's greatly underreported. I also want to point out that I was at Costco earlier picking up a prescription, and naloxone behind the counter is available for $47, and we give it away free at the health department. So that's something that's really good to know. So let's talk about strategy for a while here. So thinking back to the slide that had all of the data, knowing when folks would be most at risk for an opioid overdose, this is how we as a community have been able to respond with the help of all of our great partners. So First, we're lucky enough to have a mobile unit that this helps our team get out into the community. So we're able to go directly to where people live, shop, receive services. We're able to take that data that we collect and focus on mobile outreach to hotspots in our community. We connect with Toledo Fire and other first responders to see if they're seeing any trends, and we just kind of try to have that immediate response to that. Sometimes we partner with other agencies who can set up and offer additional resources so they can come to us, set up a table. Some of them let us use their parking lot. I know our friends at Talbot here have let us use their building and facility and parking lot since 2017. And it's just a really great way for us to be able to reach the community. So if you ever see the Narcan van, it's not a food truck, it's a Narcan van. Come up, say hi. We also have a mail order program that I will show all of you how to access at the end of the presentation, but we are able to send out naloxone to anyone who lives in Northwest Ohio or Southeast Michigan at no cost to them, but we also are able to link people, anyone in the US can actually access naloxone by mail at no cost through programs like ours. There's also statewide programs through Harm Reduction Ohio, Thrive for Change, and then national programs like Next Distro. So those are all linked on our website, and naloxone is very, very accessible for anyone. We do a lot of trainings. Last year, our team did over 300 trainings to community partners, agencies, businesses, neighborhood associations, and more. We have trained teams, and then we also do situations where we are training people our partners are working with, so their own clients, for example, outpatient groups at treatment centers. Trainings are at no cost to anyone. They can be customized to meet individual needs or interests. There's a training request form on our website if anyone's interested. There's also a data request form on our website as well. So if any of the data that I shared interested you, you can go on our website and select what you would like us to put together and send you. But there are a lot of community partners that also ask us how they can distribute naloxone as well. And in fact, that is an option. So we support over 30 service entities or individuals or agencies that distribute naloxone on our behalf. So we provide them with naloxone to distribute to individuals they work with, and then in return, they give us a little bit of anonymous data on demographics. One of the more popular ways that we have been able to expand access to naloxone in the community is through our harm reduction vending machines. We have one of our newest ones at Midwest Recovery Centers up in the corner there. It's really cool and tie-dye, and I'm really jealous about it. But anyway, this is a really great way to get some of those resources out in the community. We now have a total of 11. We just counted the other day, and they are in places like the Lucas County Jail. As was stated in my bio, we were one of the first jails in the state of Ohio to implement the vending machine strategy. And we also have one at the health department, various treatment and recovery centers. There's one at the UTMC emergency department. That was our first emergency department to access a vending machine, so that's been really fantastic. We have targeted strategies related to, reaching folks who are leaving incarceration, reaching folks who are leaving treatment centers, just making it accessible to people who are at the most high risk first. These machines might also feature other public health resources. Some of them have safe sex kits in them, drug testing strips, hygiene kits, feminine hygiene products. And then hopefully more items. We're always open to receiving donations for items of need. Right now, especially warm winter items like hats and socks would be a fantastic addition to these vending machines. They're very low barrier. There's no cost associated with them. Someone can just go right up and use it and receive their product and take as much as they need. We also utilize other types of naloxone access units like these cabinets, so the clear cabinet. These are designed more for emergency use. In the event that an overdose occurs at a specific location. So they're much smaller. Usually they only have 1 or 2 naloxone kits in them. Through a very similar project to ours, ProMedica has been able to implement over 600 of these cabinets in and around Lucas County. So that is one of their strategies when it comes to naloxone distribution. We're very appreciative of them and that partnership, because I don't know how we would be able to manage 600 naloxone cabinets, but they do a great job doing that. And then last, I just want to acknowledge the relationships that we've been able to form during, starting during COVID with our public safety and our first responders. So this is something that has been really innovative for our community as well. Toledo Fire actually piloted our first Leave It Behind program. And this is where Toledo Fire, when responding to an overdose, they actually leave a naloxone kit on scene with friends or family or individuals following an overdose. And this has successfully been able to expand to several other partners and jurisdictions here in Lucas County. And then our team, along with Toledo Fire, has also been able to provide technical assistance nationwide to folks duplicating this program. So that's a really successful program where we have actually been able to see the immediate impact of that, where Toledo Fire has gone out, to the same location multiple times, but this time, instead of life-saving efforts, the person's already up, walking, talking, and there's minimal follow-up instead of all of the life-saving efforts that would usually have to happen in the event of an overdose. So the second area of focus that I want to talk about today is syringe service programs. These are also called bloodborne pathogen prevention programs. Syringe service programs have been studied for well over 30 years, and the history of these types of programs date back to the AIDS epidemic. So this is when the spread of disease was linked to sharing syringes with others. And at this point in time, they were using bleach to clean their syringes to make sure that they weren't spreading that disease. Now, today, at syringe service programs, people who use drugs can access clean needles and other supplies so they don't share equipment or spread disease. We have two goals, and it's to never have to share a syringe with another person and to never have to use the same syringe twice. Today, studies show how they're associated with an estimated 50% reduction in HIV and Hep C infections, and they're the most effective way to reduce overdose death next to stopping drug use altogether. And in fact, people who use syringe service programs are actually 5 times more likely to enter drug treatment and 3 times more likely to stop using drugs altogether. These types of programs are also extremely beneficial to communities. There are statistics that are linked directly to safe needle disposal. This reduces dangers associated with needle sticks for public and for our first responders. So syringe service programs also connect people to things like wound care, overdose prevention tools, treatment options, and other health services. So it's not really about encouraging drug use, but rather keeping people alive and healthy. So picture a safety net that reduces harm, but opens the door to non-judgmental care. Ohio officially authorized programs for bloodborne infectious disease prevention in the Ohio Revised Code in July of 2017, and this allowed local health departments to establish these programs, providing legal protection for staff and for participants under specified conditions. So another way to think of a syringe service program is like providing clean water during a disaster. You're not promoting the disaster, but instead you're providing people affected by the disaster with resources that are going to help keep them alive. The Northwest Ohio Safe Service Program, which I also just call NOS, opened in August of 2017. But cities like Cleveland and Portsmouth have operated syringe service programs for years prior to that under local public health emergency declarations, just due to the burden of the opioid epidemic on those communities. So we now have 5 access points here in Lucas County that individuals can attend anonymously on a weekly basis. There's approximately 27 approved syringe service programs in the state of Ohio, but the closest one to ours would be in Hancock County and Findlay, and there's only 2 in Northwest Ohio. They're called Safe Works down in Findlay, if anyone's curious, and from that area. So at NOS, we see literally thousands of participants a year, and I can tell you that distributing syringes, while it sounds like the most controversial thing, is probably the most boring part about the program. And in addition to safe drug use supplies, participants access communicable disease testing, so HIV, Hep C, and syphilis testing, some first aid kits and things like that, overdose prevention tools like naloxone and drug testing strips, hygiene kits, biohazard containers, safe sex supplies, and more. Our program is staffed with experienced team members, which include a registered nurse, a linkage to care navigator, and a harm reduction health educator. And our staff just meets people who use drugs in the community in the most non-judgmental approach, just to offer whatever help they are interested in on their own terms. So oftentimes when someone comes to NOS, it's their only touch point within the system of care because they've just dealt with so much stigma themselves. Our team can help someone rebuild the confidence in themselves to take those steps in harm reduction and positively impact their lives. So whether that's reducing the chaotic and negative impact that drugs are having on their lives, maybe they're working on getting a job or finding stable housing, healing wounds that are quite literally years old, or entering into treatment and consequently sobriety. I also want to do just a quick touch base on anti-stigma. So just a quick reminder that compassion and empathy are going to be the best approach to reducing stigma. So a few different things that we can do in our daily lives to make that happen for folks. Using empathy first language can greatly change someone who uses drugs or someone with substance use disorders experience for the better. So a few examples of this might be referring to people who use drugs as just that, rather than saying things like addict or junkie, words associated with more of a negative connotation. Likewise, rather than using phrases like clean to refer to a person as in recovery, just say that they're in recovery, because that person was never dirty to begin with. Drugs quite literally hijack the brain, not a person's character. So substances rewire the brain, especially in parts that manage stress and reward and impulse control. But once addiction takes its hold on someone, it's no longer about willpower and now about biology. So one of the things that we can do is treat substance use like a health condition, a chronic disease, because that's what it is. We don't blame people for having diabetes or asthma. We focus on treatment and support. So substance use disorder deserves the same compassionate, evidence-based approach. And then lastly, just that emphasis that recovery is possible. With stability, support, and non-judgmental care, people do recover every day. And then really quick, I do want to let you all know a few ways that you could get involved if you were interested. First, we have a local coalition, the Lucas County Substance Use Response Coalition. We meet quarterly. Meetings are open to the public. Information can be found on the health department's website. And every year, as was said in my introduction, we hold an event in honor of Overdose Awareness Day. It usually falls around August 31st, which is International and Ohio's Overdose Awareness Day. It's called Chalk the Walk. At this event, we gather to remember and honor those that we've lost to drug overdose. We come together as a community. It's a really beautiful event. We do have vendors participating in activities. We really try to center those folks who have lost someone and make the event less of a health fair or a resource fair and more of just a time for them to get to come together and be a community together. So keep an eye out for that. Like I said, it's around August 31st. And we would love to see you there. Last, I just want to wrap up, but before I do, I'd love to have my team stand because these are the folks that are really actually doing all of the hard work. I'm just like the chaos coordinator in the background, right? So thank you so much. Thanks, guys. So these are the ones who are making the wheels turn. Obviously, in a lot of the photos, these are the people you see and not me. I do have a QR code here. If anyone is interested in getting naloxone by mail, I didn't bring any because I thought it would be cool show and tell. You can just scan the QR code, put Joe to work, and order a kit right to your home or whatever address that you'd like. We also have some other links on our link tree, including our social medias, and that's also my contact information if anyone is interested in getting connected. But I think I'd like to open it up for questions if anyone has any.
Well, is it on? Perfect. So I don't have any questions, but I have a couple statements I'm going to make. First and foremost, thank you guys for what you guys do. Many of you don't know, and some of you do know my story. I wouldn't be here without naloxone. I overdosed in 2013. I wouldn't be standing here right now and be a father today, or a son, or a grandson to my family because of that. So that drug did save my life. And I'm a Rotary member now, so look at that. How full cycle things come. I think 10 years of sobriety this year too, so that's a cool thing for me to say that actually on top of that. So, first and foremost, I think that as much as an agency, I want to ask you guys that, what can we do for you? Because that's kind of statement I want to say this year is like, as Rotary members, how can we support what the health department needs from us? Where is there a lack of or resources on our end to you guys, and what resources do we have that you need? Because that's what comes down to it. Because the last thing I want to do is see you guys lose funding, because yes, you guys have one of the vending machines at my business, and I love it, and the clients use it all the time. And we have the boxes of it. Joe has supported in all our recovery houses, the 9 that I own in town. There's one of those boxes in every single address, because it's very important the clients know that if for some reason something's going on, I want them to be able to save their lives and not be stuck there to go through what I went through, and have all the support they need. So again, but thank you guys so much for your guys' hard work. You guys do a lot for our community. I think it's like you guys are superheroes in my heart, because I know what you guys do, and I see the other side of it. A lot of people in this room don't see it as much, as besides sometimes we might see that person that's homeless on the corner begging for money. Well, it's a lot deeper than that. They're a human being. There's a lot of things going on in their heart that need help with, and sometimes it's just us saying, hey, that we care. So thank you.
Yeah. Thanks so much, Josh. That's a really good question. And I think that right now, we're at a time when we have a lot to offer the community. We receive naloxone directly from the state. The state of Ohio is very unique in the fact that we have a program called Project Dawn, which stands for Deaths Avoided with Naloxone. So the state has taken that on to provide naloxone to localities at no cost to us. We don't see that cost impact us. They see it impact them, and they just worry about that for us, and we request what we need. And so we're very secure there. We're very secure in several other of our resources, but always supporting your local mental health levy is a great way to support us. The Mental Health and Recovery Services Board is a wonderful partner of ours and provides some of their tax levy to fund some of our services that are helping the most vulnerable. But then also just, taking that extra step to have patience with people. You never know what someone else is going through. You never know what someone else is going through. And like Josh said, there's a lot of ways to make sure that you're just set up to help in a time when someone might need help. Because, you never know when something like, you hope that something like an overdose is never going to occur at your business or place of your agency or where you work or where you live, but you never know if that's going to happen, and you probably hate to regret it on the back end. So just starting to do things like that, put a naloxone kit in your first aid container. Our nurse wasn't able to join us today. She had some car trouble this morning, but she would be so mad if I didn't plug in the fact that we're always open to donations as well. So if you're someone who could supply or provide things like socks, hats, gloves, small things. We do work in a mobile capacity, so we do have limited access to what we can bring, so we do try to keep things small. But water bottles, if you're an agency that does any type of community service and you want to come hand out things like sandwiches to our folks or a water bottle and just come and say, hey, we're always open to partner in that way. These are people who, their confidence does need to get built up. There's a lot of stigma that has occurred. People who could leave our facility and quite literally die because of some of their injuries and wounds that they literally won't go to the emergency department to address because they've been so stigmatized. So any interactions where we're just able to bring that compassionate approach and empathy and dignity and respect back into this type of program, we're just open to. And like I said, I think community and connection is the opposite of addiction. That's a popular phrase in our area, but I just feel like it is true. So that was a good question. Thanks, Josh.
I know the health department also has jurisdiction over the lead paint issue. Is there any correlation between the lead paint effect on individuals or the environment and drug usage?
That's a really good question. I don't know the answer specifically, but I do know, when you look historically back on things like redlining and just our community as a makeup and where there are more underpoverished areas, I'm sure you would find correlation between things like lead and that.
Thank you.
I was hoping Mr. Wasserman doesn't ask a very long question. But anyway, my first question is that, is it possible in a community like ours to keep a database of hardcore addicts? Because in a given community like Toledo, we will have only so many hardcore IV drug users. Is it possible for you people to maintain a database, their names and addresses, so you can approach them periodically and educate them?
So for the health department to do that, no. One of the things that's written into the Ohio Revised Code with our program is that our program's completely anonymous. We don't have anything set in place where we're asking a name or for an ID or anything like that. So everything we do is completely anonymous. But I will tell you that one of the things that our Lucas County Sheriff's Drug Abuse Response Team does, they're what's called a quick response team, where they are doing post-overdose work with folks. They are working with different agencies like Toledo Fire to understand who is at risk for overdose, who is overdosing, and they do post-overdose response, where they'll actually meet that person in the community, maybe at their home, and try to engage with them. Because we know right after following an overdose is a really good time for engagement. And so they are an organization that does do that work.
And second, I'm a retired physician, and I want to give a physician perspective. In 1980s and 90s, Joint Commission, which checks the hospital for quality of care, they mandated that every patient has to be pain-free. And they will force us to ask them, okay, what is your pain level? And then yearly they look at the hospital records. Was the patient pain-free or not? So what happened is that it became a standard of care in which it was the hospital's interest, the doctors keep the patients pain-free no matter what, because otherwise you'll get a demerit from Joint Commission. So when you ask people what your pain level is, and invariably almost everybody is trained to ask how much out of 10. And I, as a practitioner, never really asked that number, because I realized I cannot depend on that number, because the person is saying 9, but he looks comfortable. The way he speaks to me, he doesn't appear to be in pain. He's not moving around. He's not in anguish. So really, that Joint Commission standard somehow forced physicians to prescribe higher level of narcotics. And that maybe that led to some addiction.
Mm-hmm. Yeah, thanks for that perspective too.
Thank you very much.
Well, thank you so much for your time and attention today. I really appreciate it.
Stay up here. Just one more thing, I promise. Then I'll let you say. Maj, thank you for your time today. We really appreciate your presentation and the topic that you brought up to us today. We thoughtful as it is, and we wanted to give you in appreciation a book called Historical Tales of Toledo. It's actually written by one of our past presidents, Clint Mock, and we appreciate your time. We'll also make a donation in your name to the Polio Plus Fund, which is Rotary International's effort to eradicate polio from the face of the planet. So again, thank you for your time. We really appreciate it.
Thank you so much.
And Josh, thanks for sharing. Really appreciate that. I was talking to Martin earlier today too at Harbor about how it's a difficult time probably around the holidays for people who struggle with substance abuse use disorder. So I think all of us could be better for thinking of those folks, and if we know someone, to look out for them, maybe reach out to them during the holidays just to touch base. So something to think about. All right, next Monday, please join us for the annual Toledo Rotary tradition that we will have the Toledo Symphony Orchestra here performing for us before the Rotary Christmas break. And so please come, enjoy the music. Also, feel free to bring any guests if you want to bring guests. It's a great program to bring guests to. There will be 3 committee meetings this afternoon. Finance Committee is going to meet in Summit D. The Annual Golf Outing Committee is going to be in Summit C. And Community Services Committee will meet later this evening at 4:30 at Maumee Bay Brewing Company. So thank you all for joining us today. Please go out and unite some folks for good. Thanks.